My name is City Councilor Lodge Michael Flaherty, Chair of the Committee on Public Safety and Criminal Justice. Today is October 28th, 2022, and we are here today to discuss Docket 1104, order for a hearing to address contaminated beverages in clubs and bars in Boston, that was sponsored by my colleague, City Councilor Gigi Coletta, as well as City Councilor Ruzzi Louis-Jean, referred to the committee on September the 14th. In accordance with Chapter 107 of the Acts of 2022, modifying certain requirements of the open meeting law and relieving public bodies of certain requirements, including the requirement that public bodies conduct its meetings in public, in a public space that's open and physically accessible to the public. The City Council will be conducting this hearing remotely. This enables the City Council to carry out its responsibilities while ensuring public access to its deliberations through adequate alternative means. The public may watch this via live stream at www.boston.gov/city-council-tv and on Xfinity 8, RCN 82, FiOS 964. It will also be rebroadcast at a later date on Xfinity 8, RCN 82, and FiOS 964. This hearing will be recorded. Members of the public may offer public testimony via Zoom or provide written comments to the committee. That will be made part of the public record in this matter and shared with all members of the council. Members of the public should email Christine O'Donnell at christine.o'donnell, O-D-O-N-N-E-L-L, at boston.gov to request a testimony link for public testimony via Zoom. Members of the public can also email the committee, and you can email at ccc.ps@boston.gov to provide written testimony. I'd like to stress that we need information for people who are providing public testimony via video conference, especially if you're dialing in with a phone number or if you have an unrecognizable username. So please make sure that your name appears on the Zoom. With us today, obviously, I see several of my colleagues, Councilor Gabriella Coletta, Councilor Ruzzi Louis-Jean, who are the two lead sponsors. I see City Council President Ed Flynn, City Councilor Kenzie Bach, City Councilor Liz Braden, and I'm sure other colleagues will be joining us. We're also joined by Segun Idaho, Chief Economic Opportunity and Inclusion, Kathleen Joyce, Chairwoman of the Licensing Board, and I also see Lieutenant Richard Driscoll, Boston Police Department Family Justice Division Sexual Assault Unit. So with that, I'm going to turn it over to the lead sponsors, as well as my colleagues in arrival of their appearance. And if someone can just let me know, was it Ed or Kenzie? Kenzie, Ed, what was the order of arrival from colleagues outside?
President Flynn was ahead of me.
Thank you, Councilor.
And I would say it was Liz, Councilor Braden.
Yeah. All right, so Liz, then Ed, then Kenzie, correct?
Correct.
Is that it, Gigi? Was Liz first, then Ed, then Kenzie?
Yep, and of course I'm Councilor Louis-Jean.
Perfect, and Councilor Louis-Jean is a lead co-sponsor. So Councilor Coletta, you have the floor to give some introductory remarks, followed by Councilor Louis-Jean.
Thank you, Chair Flaherty, and thank you all so much for being here. I love the fact that we have a lot of participation from my colleagues. This is clearly an issue that we're seeing and hearing about across the city. And that's exactly why I filed this hearing order, just to call awareness and attention to this disturbing trend that we're seeing across the city, especially now that we are I'm looking at the calendar, about 2 months into the school year. Kids are back. Boston already has the highest ratio of 20 to 34-year-olds among large U.S. cities. And I have seen, and I think just because I may be the millennial counselor, not the only millennial counselor, but certainly the youngest, but I have had a lot of young women and men detail their experiences to my office, sending me emails and tagging me on social media platforms just about the stories, outlining how responsible they've been. They've just had 1 or 2 drinks with their friends, but quickly their night has changed for the worst without reasonable explanation. And so, you expect to go out and have a great night with your friends, only to have it completely derailed to the potential harm at the hands of a bad actor. And it can happen to anyone. I have talked about the fact that it happened to me in undergrad. It was a close call, but I caught it just in time. And here in Boston, I know that the Boston Police Department is taking this very seriously. They have already put out formal notices to the public, and the most recent one was put out just yesterday, warning patrons of local area bars and clubs about drugs such as Rohypnol I hope I said that correct, in the drinks of unsuspecting victims. And throughout this hearing, I just want to be mindful that we are not placing the burden of behavior change largely on victims. And that's another reason why I put this hearing out there. I think this is one of those instances where folks are largely blamed for not being careful enough or are too ashamed to come forward for fear of being judged. So throughout this hearing, and I'll get into the goals and how I would love the conversation to go at the discretion of the chair, but just using this opportunity to change the narrative around incidents like this that do disproportionately affect women. And the emphasis from many is often focused on what we need to do to protect ourselves rather than what we're doing to prevent bad actors or bad actions on behalf of those responsible. So just really quickly getting into the goals of the hearing, and then I would love to turn it over to my co-sponsor, Councilor Louis Zhang. But I would love to get a better understanding from the City of Boston through the police department, the licensing board, and Chief Adwowu of what is happening in our city. So getting a good understanding of the snapshot and getting concrete data, how many cases and where is this frequently happening. Walk through the entirety of what happens when confronted with a potential case that is reported or identified. Talk to the police department about existing reporting protocols and identify opportunities for reforms. And then of course, hear from Chief Adwowu, who's doing amazing work in his camp about what the city is thinking about in terms of the current situation and moving forward as we try to attract more folks into Boston, especially the downtown core, how we're moving forward, working with the potential late night czar to protect patrons at the end of the day. Then after that, I hope to discuss with area colleges what is happening on their campuses and what they're doing for any sort of preventative measures and how we can all collectively work together to set both restaurants and colleges up for success to protect their patrons and students respectively. And then of course, how to best provide support and justice for victims. We have an advocacy panel that will be able to provide their perspective. So I am looking forward to that. And I'll stop my comments there, but I just want to thank the administration, members of the higher education institutions, and the advocacy organizations for being here. Thank you.
Thank you, Councilor Coletta. Chair recognizes the City Council Root C. Louis June.
Thank you, Mr. Chair, and I want to thank my council colleague, Councilor Coletta, for having the vision to bring this hearing forward and allowing me to co-sponsor it with her. As we all know, and as she stated, the rise of drink contamination at restaurants, bars, and clubs throughout our city is a pressing issue that needs to be met with urgency. Boston is a young and vibrant city. Yes, Gigi is our youngest member, but she is not the only millennial, and so I too am a member of that tribe and enjoy Boston's nightlife and want to make sure that it's safe for everyone. Boston is one of the fastest growing cities for young professionals, and it's important for us to do everything we can to support growing nightlife. But we can't do that without also ensuring residents feel safe. Increasingly, too many patrons, especially women, are feeling unsafe because of the rising issue of contaminated drinks. The BPD received 57 allegations of drink spiking in Boston between January 1 and July 31st, but we know that this is most likely an undercount because so much of this goes unreported. It's also vital that while we have this conversation about the steps we can take to prevent this from happening, we also take the opportunity to acknowledge and apologize to folks who have been victims and who are survivors of drink contamination in the city. Whether you've come forward or not, we see you and we are here to do the collaborative work necessary to ensure that your experience and that your pain is never, ever repeated. And the only way we do this right is to bring all stakeholders into this dialogue. So I want to commend Councilor Coletta for really working so hard to get a robust and diverse group of folks here. And it's going to take all of us, restaurant owners, law enforcement, universities, and survivors really showing us the way. I'm looking forward to this collaborative conversation and finding solutions to make sure that residents and visitors alike enjoy our city. We're going to get into it more deeply, but just at the outset, if there are any folks listening, I know that my office, we posted about this and folks reached out to my office saying, I'm a survivor, I'm a victim and love to offer public testimony, or I'll be listening in. And so I want to make sure that at the outset that folks know that there are resources available, whether it's the Beth Israel Center for Violence Prevention and Recovery, In Newton Wellesley Hospital has a domestic violence and sexual assault program. I'm very happy that we have the Boston Area Rape Crisis Center, really experts here to be advocates with us on this panel. They have a 24-hour multilingual hotline at 1-800-841-8371. And their website is barcc.org. And I'm sure we're going to be getting more information shortly from, I believe, Ms. Corcoran, who is going to be here from the Boston Area Rape Crisis Council. I want to shout out my friend Dwayne, who is currently the executive director of the Boston Area Rape Crisis Center, and just want to commend everyone for their work, including administration for being here and being on this panel. We have a lot of work to do, and I know that with this brain trust here and with us following recommendations by survivors themselves, we'll be able to make some progress. So thanks again.
Thank you, Councilor Lejeune. Councilor Liz Braden, if you're available for a brief opening. Councilor Flynn, Council President Ed Flynn for a brief opening.
Thank you. Thank you, Mr. Chair, and just want to echo very briefly what Councilor Lejeune and Councilor Coletta said. This is an important public safety and public health matter. It impacts so many people. As a father who has a young daughter that's in her late teens, early 20s, you know, and represents an area where there's a lot of young women in South Boston. This is a very important discussion. This is a very important issue. I want to say thank you to the city officials that are on this call, with the police, the economic development team, the licensing team, and others. But I also know there's colleges here, including someone I work with very well, Ken Ryan. So just want to say thank you to my colleagues for sponsoring this important subject. Thank you, Mr. Chair.
Thank you, Councilor Kenzie Bach. Brief opening.
Thank you so much, Mr. Chair, and thank you to the sponsors for filing this. Like several of the councilors on the call, I represent some substantial downtown neighborhoods, including the Fenway and its entertainment district, and the West End, where we've seen, and Back Bay, where we've seen really concerning instances of this. And we've been hearing about it in my office. And so really feel passionately that we've got to figure out ways to reduce the incidence of this. And a big question of mine, just to put on the table, is, you know, I totally agree with Councilor Coletta that I don't think that we can just keep putting the vigilance on people who go out for the evening. And to me, it feels as though this is the type of thing that if somebody does it in an establishment and they get away with it, then they're likely to come back to that establishment and do it again. And while that's not our establishment's fault, I think that, you know, the question of how are we alerting the establishments and how are they becoming more vigilant? Because it feels to me like, you know, certainly I know so many of our restaurant and bar owners in this city, and I know that none of them want this happening in their establishments. And so it feels to me like, you know, if we're putting folks on notice, hey, we got a report, we think it was your place, and in a way that lets people tell all their staff, like, hey, we really got to keep an eye out, we think this happened. That would be my hope for really a type of vigilance that we do want to encourage. So I would love to understand how that feedback loop is working and how we can make it work better. Thank you.
Very good. Thank you, Councilor. And I was informed by our colleague she had to take a call, but she'll be joining us shortly. So we have three great panels today. The administration panel led by the chief, the chairwoman, and the lieutenant, followed by an education panel from representatives from our institutions, as well as an advocate panel. So I'm going to get right into it. Chief Sagan Idaho, if you can, you have the floor, and we're going to go from you to the chairwoman and to the lieutenant. Good morning.
Good morning. Thank you very much, Mr. Chair, Mr. President, to Councilor Coletta, the other sponsors of this particular legislation or hearing order, and the rest of your council colleagues. I want to thank you for creating this space for us to not only share how serious we take this issue, but mostly to hear from others on the impact this is having on them and recommendations that we can take to heart to implement as quickly as possible. I do want to say that this is an issue that we take very seriously on our end for many of the reasons that were brought up in earlier statements. Since the summer, myself and Kathleen and the licensing team have been working with BPD and with the operators to create a feedback loop to understand what is going on the ground so that we can be as supportive as possible to make patrons aware, as has been stated, but also to ensure that the venues feel emboldened and empowered to reach out to us to let us know what's going on, and that there is no, they're not going to get in trouble for reporting to us what's going on, but that we have to know what's going on in order to be able to address it. It was stated earlier about one of the positions that we're hiring for, the Director of Strategic Initiatives, and one of the first pieces of their portfolio will be the late night, which is how they've been dubbed. The late nights are, unfortunately for them, but at the end of the day, that will be part of their portfolio. And if we want to be serious about downtown, as was reported this week, of being a 24-hour location in the city, this is an issue that we need to address head on and ensure that if we're going to be a family-friendly city, one that is 24 hours, that none of those hours are people feel unsafe to be out and to enjoy the nighttime here. I will say that we had already been working with venue operators to get folks in a room to talk more broadly about this. And so I want to appreciate Councilor Coletta for putting in this hearing order and the chair for organizing this conversation for today, because we will now be able to take what we hear today to our meeting with large venue operators across the downtown area and the rest of the city. We do plan on holding that conversation next week. And we know that all of the folks that have been invited are very interested in sitting down as quickly as possible to address this. At the same time, our office is committed to not just talking about this, but supporting financially. And so we have found, after looking through our own budget and economic opportunity and inclusion, finding some dollars to be able to support venues who may not be able to afford the coverings for cups or other items that we can purchase to make sure that patrons are kept safe when they are enjoying the items that they're purchasing in these different venues. These are a couple of the things that we're doing and working on, but of course, we want to make sure we're doing everything we can be doing to keep people safe and feeling as if they can enjoy the night without these incidents. And so I'll be here for the whole hearing to not just for this panel, but to hear what others have to say on this so that we can take that information back to our side, talk about it amongst ourselves, and bring it to our conversation next week. The last piece of this is that this will not be the only time that we're meeting with people. The intent of this meeting next week is to make sure that we are establishing a task force on our end in EOI so that on a regular basis, we are convening this group of stakeholders to keep that constant feedback loop going, so that as these incidents are being reported to the police and to these venue operators, they are then making us all aware here at the city side. And again, making sure that everyone is comfortable sharing that information, that they're not going to get in trouble, but that this is something for us to act on. So again, multiple ways that we are working to address this, but looking forward to the conversation and appreciate this opportunity.
Very good. Thank you very much, Chief. And then we're going to go to Lieutenant Detective Richie Driscoll from the Boston Police Department. Good morning, Lieutenant Detective.
Good morning. Once again, thank you for hosting this meeting. I'm just going to briefly introduce myself. My name is Lieutenant Detective Rich Driscoll. I work in the Family Justice Center. I represent the Sexual Assault Unit, Human Trafficking Children, Internet Crimes Against Children, and then we also have a cold case initiative, under a SAKI grant. I just want to dive right into the topic and just echo the comment. I know Coletta, she mentioned that nothing we want to do is victim blame or put the onus on those who are being victimized by this issue. I completely 100% agree with that. And with respect to some of the issues that we're seeing, I'm just going to go into some brief statistics. So we're aware of about 73 reports where a victim or witness alleges a drink spiking occurred or fears that one occurs. Of those 73 reports in 2022, 3 were reported to have resulted in a positive drug test for opioids, and then a 4th was reportedly the result of an unknown date rape drug. With that said, there's no denying that an issue does exist. And what we're seeing is 2 main domains where it's occurring. The licensed premise, which we're speaking of here, and on college campuses, on the party scene. There are actually 2 separate issues as well. What we've seen in our investigations with the sexual assault unit, including a cold case investigation and some other issues of a concoction called Lean on the college campuses, which is basically a mixture of Sprite, Jolly Rancher, and cough syrup containing codeine and promethazine. That's one domain. And then the other domain is obviously the licensed premises, the bars and things like that, and those types of places where alcohol is served. Just to go in terms of how we view some strategies that we're kind of seeing and things that might be successful is target hardening. And target hardening is a technique mostly used for, making your home burglary proof or things like that. But if we take the receptacles themselves and have some strategies to guard the receptacle and watch them from potentially being spiked, we think that would be a very, very helpful strategy. Additionally, having a bar buddy or a buddy with you, most people don't go out by themselves. So if you have someone that might be able to, keep an eye on you, and potentially it might be a situation where they, say, hey, you've overindulged a little bit, maybe, just watch yourself, have a water or whatever else. Additionally to that, with respect to the college party scene, what we think it is mostly, awareness and observations. Last month we met with an organization called Basin. I know Lieutenant Detective Kelly O'Connell's on here from BU, and it's a numerous numbers of colleges that, and we had a back and forth regarding the issue that we saw with lean and the whole phenomenon there. And they were very receptive, and it really just became about awareness, knowing that such a product exists and that it's growing in some of the reports that we've seen on college campuses, and seeing who is the targeted population. A lot of incoming freshmen who are new to the city and are unaware of certain issues. Having that knowledge and awareness out there, I think is really, really a big part of our strategy. And that's kind of some of the partnership that we've had with the college campuses. Commissioner Cox really stresses the importance of community policing, even in our domain of the investigative services. And traditionally in the past, investigative services really haven't had a community policing aspect to it, but we've tried to embrace that, especially here with SALT and some of the other divisions here. We've tried to really co-sponsor and work with, whether it's the colleges or community organizations and stuff like that, to get certain issues out, such as this. And this speaks to what media relations and John Boyle and his crew over in media relations have been doing with the community alerts about getting the information and knowledge out there, because we really do think that awareness and understanding of the issue does help the person. And I hope that doesn't look like we're trying to shift the onus onto the victim. So we're certainly not trying to do that, but good defense is really, really important. In addition to that, with speaking about the licensed premise, one observation in just discussions around with my superiors and police officers in general is we think there might be a reluctance to report from a lot of licensed premise. So maybe the consideration of a Good Samaritan exception for reporting of drink spiking, so that the licensed premises and the bars are not afraid to speak up, but being, sanctioned for over-serving. that might be their fare. And the last thing we want is to create a dark figure of crime where it's unreported, because then that makes them that much more muted. So I think relieving them of that fare may assist with getting more and more reporting out, and then partnering with them with the various target hardening aspects that we talked about with the drink, and possibly institution of more video cameras around the bar and on the bar. I know that certain places do that to focus on specifically where the drink is poured, so it can relieve a person. It also assists greatly in our investigations after the fact when we're trying to determine what exactly may or may not have occurred. And a lot of times it can provide closure for some people who just don't know what occurred. And sometimes we can come back to them and say, you had X amount of drinks. Do you think, it possibly could have been an overindulgence issue or something like that? And I'm speaking to when there's just a report of someone that says, I don't know what happened. The next thing I know, I woke up. They're not reporting any additional crime. Obviously, if it's a survivor issue or an issue with it's dealt with completely and totally different. I think that's about all I have. I just wanted to once again thank you, and on behalf of Superintendent Felipe and everyone at BIS, we're willing and able and helpful to do whatever it takes to assist in this issue. And once again, thanks for bringing the issue to light. Thank you.
Thank you, Lieutenant Detective Driscoll. We've also been rejoined by our colleague, City Council Liz Braden. I also see that our colleague, City Council Julie Mejia, is joined. And I want to recognize Chairwoman Kathleen Joyce. And Kathleen, it's the chief sort of touched on it, obviously, and Lieutenant Detective just did as well. In the past, our city oftentimes would punish establishments for basically giving that information. Anytime there was an incident, it could be over-serving, it could be intoxicated person, it could be a fight at an establishment, it would trigger an automatic violation. And I have to say, you've done great work as the chairwoman, and you've put a focus on see something, say something, and then you will do an analysis, obviously with the help of the Boston Police Department, to determine whether it's a sort of a habitual chronic type of thing, but you always encourage, in any forum I've been with you, you've always encouraged establishment owners to come forward to give that information. Oftentimes in the past, they used to push the problem out to the street or out into the alley, or they drag, everybody and push them out the back. And they just wanted to get them off the premise and go like this, because a premise violation means you have to hire attorneys, you have to get a hearing, you face a suspension. So a lot of times they were sort of kind of covering it up, or they were ignoring that it was happening. And credit to you and to your team since coming in as the chairwoman, that has not been your approach. Your approach has been, hey, give us the information, tell us about this, we'll work with you. But if you see something, you have to say something. So I just want to touch on that, because Lieutenant Detective Driscoll had just mentioned premise responsibility here, and the chief did as well. But good morning, Commissioner Chairman Joyce, and welcome. And you have the floor for your comments.
Thank you, and thanks for inviting me to this conversation today. And just to echo the comments that Chief Idowu started out the morning with, and what Lieutenant Detective Driscoll just expanded upon, we are trying to educate patrons and licensed premises that they should share this information. We can't help them unless we have the information. We have held eight hearings before the licensing board on alleged drugging incidents. Not a single one of them have resulted in a violation, and that is because we haven't been able to prove that someone's drink has been drugged by somebody, or that the licensed premise was responsible for that. Why we continue to hold these hearings is to raise public awareness and to cooperate with Boston Police and to encourage people to come forward, just as you said, Counselor. In addition, we've had 2 community meetings. We've gone out to East Boston and we've had a downtown meeting. And it was very telling in East Boston, there was definitely a fear to call the police if they thought somebody was drugged in their licensed premise, because as the owners, they knew that they hadn't drugged the person, but they were afraid that they would be held responsible. So we explained to them, call us, we will help you. We want to help the patron. You will not be punished for this, but we need to explore these issues publicly so that we can learn from them and we can help solve some of these things. It's to help patrons understand what's going to happen and to eliminate the fear from these licensed premises that they're going to be shut down if somebody was, found to have been in their licensed premise and passed out or later on found out to be drugged. Part of that is call the police. We try to encourage licensed premises. If you suspect that somebody who has only had one drink, this is what we hear, they only had one drink here and suddenly they fell off their bar stool and they couldn't walk, we say call the police. Get help for that person and let us help and let the licensed premise establish whether or not there was something else that could have been done. We're trying to be a partner. We're trying to cooperate. We're going to continue to raise awareness. We've put out our own advisories a couple of times. We've worked with BPD. One of the frustrations is people are going to social media and people are going to the press instead of going to the police. So we can't help them if they don't involve us in the process. And I know we're all trying to work together on this because it is a real, true public health and public safety issue. So we'll continue to do that work. As Chief said, we're going to be pulling together some of the big stakeholders where we're seeing these spikes and trying to learn from them, help the bigger places, help the smaller places, and try to reduce this across the city because it's a very scary time. But short of videos of someone placing a substance into a drink, that drink being tested and that person going to the hospitals and getting tested, we wouldn't be able to find liability on the part of the licensed premise. And one thing that I know Boston Police has done downtown is they've worked with the emergency room personnel to encourage the emergency room personnel to test people when they present in the emergency room. That wasn't always the case. So we would hear anecdotally that somebody went to the emergency room, but a drug test wasn't done. So I think we've had those conversations. Captain Chicolo downtown has led the charge on that. And we're just continuing to brainstorm ways. People feel the urgency of this. People want to work together and they want to help be part of the solution. I've noticed in the last 6 months, we're getting calls from licensed premises. Police haven't showed up yet to write us up, but we think somebody was drugged. And, what are you seeing? What are you hearing? They were only here for 25 minutes. Their bar tab shows they had, one drink. So we don't have an answer right now, but we're trying to work together to help, solve this problem for the safety of everyone in our city.
Thank you, Chairwoman, and then I'd like to take obviously the opportunity maybe to expand the circle a little bit. I know that we got Dr. Judy Platt, we've got Lieutenant Detective Kelly O'Connell and Ken Ryan from BU, and what you're hearing obviously from the first panel, and if we could maybe get some of your thoughts before we get into questions from my colleagues. So I'll defer to either Dr. Judy Platt, Lieutenant Detective Kelly O'Donnell, or Ken Ryan from Boston University as to who would like to weigh in here.
Yeah. Well, thank you very much, Council Flaherty, for this opportunity and for holding today's hearing. And want to, on behalf of Boston University, obviously thank Councilor Coletta and Councilor Louisiane for sponsoring today's hearing. Just for the record, my name is Ken Ryan. I'm a lifelong resident of South Boston and Director of City Relations in the Office of Government and Community Affairs. I'm joined today by Detective Lieutenant Kelly O'Connell of the Boston University Police Department, as well as Dr. Judy Platt, Chief Health Officer and Executive Director of Student Health Services here at Boston University. We obviously appreciate the opportunity to discuss Boston University's prevention and response efforts amid this recent and concerning uptick, particularly ahead of the Halloween holiday for college students and young people in the city of Boston, and really to discuss ways that we can be working collaboratively with everyone on this call, Boston Police Department, Suffolk County PA's office, and our community partners on best practices, risk mitigation efforts, and making sure that we really place the blame where it should be, which is on the folks that are committing these acts against innocent people. So would love to turn it over to Dr. Judy Platt to get into some further discussion about what the university is doing, followed by Detective Lieutenant Kelly O'Connell.
Great, thank you, Ken, and thanks to everyone for having higher education participate in this meeting. This is my first council meeting, and it's quite impressive just to hear all of the collective work that is being done around the city in support of this concerning increase in cases that we're hearing about. So from the higher ed perspective, actually, let me stop. From Boston University's perspective, we are certainly hearing about increasing instances of students relating concerns that a drink must have been spiked. And it's not something new that we hear on college campuses, as all of you are probably aware, but there has been a noticeable uptick even from the summer when we with the help and collaboration with Boston University Police, sent our first blast message to the entire campus community to raise awareness about this concerning issue that was occurring. We're hearing more about it. The challenge is, as Lieutenant Detective Driscoll mentioned, we don't know the extent of it, and it's not something that we typically track. So a student may come to the primary care office and student health services and say, I think I might have been drugged over the weekend. A conversation ensues, we let them know about resources, but it's not codified anywhere in the medical record. Now, if a student goes to our Sexual Assault Response and Prevention Center, that's part of student health services, then we have a way that we track these reports. But it depends on to which department a student might present. And while that may sound terrible to say, it's just not something that we spent a lot of time tracking because we didn't hear about it to a great extent previous to the past several months in 2022. So I can tell you anecdotally, and Lieutenant Detective O'Connell will probably add as well, that we are certainly hearing more about this. But in terms of how it has increased, we don't have the data yet to be able to speak to that, but rest assured, we're working on it. COVID has really strengthened the relationships that universities and colleges have across Boston, and we belong to the Boston Consortium, which is a group of 20 member institutions, not all of whom are in Boston, but many of whom are in Boston or in Cambridge or close by. And after we received an invitation to come speak at this council meeting, I queried the other health center directors on what they are seeing. And for those who were able to respond, it's not much different from what I've told you. We're hearing more about this, but we can't quantify it. And we don't know exactly the extent to what it may be, the extent to which this is a concern on our campuses. But everyone is really aligned with something's going on, we're hearing about this. And that's in Boston, but it's also in Worcester at Holy Cross and other universities that are sharing and collaborating with us through the Boston Consortium. So I think in terms of what we are doing, certainly at BU and at other university campuses, we're trying to raise the awareness. I appreciate that many members of the council meeting today have talked about the delicate balance between raising awareness and victim or survivor blaming. So I had a parent who reached out to me very emphatically in August and asked if we could purchase 40,000 condom cups for every student at Boston University. And I stopped and started looking on Amazon at the price of doing that. But then also, of course, stop to think about what the messaging is that we want this to be. And certainly we don't want someone to come into an emergency department or to student health services and the first question is, well, did you have a condom cup? Did you bring a buddy with you to the bar? Were you doing all of these risk reduction techniques to ensure this wouldn't happen to you? So I just appreciate that everyone has called out how important that balance is. Certainly we have done a number of campaigns with Boston University Police Department, with our marketing and communications department here at BU to raise awareness. There have certainly been harm reduction techniques mentioned. Leave no terrier behind, stay with a buddy, know your plans, have an emergency plan in place for you and members of your groups. But I think we've tried to place greater emphasis on what are the signs and symptoms that you may have had your drink spiked, right? That falling off the stool, after one drink that has been mentioned, that feeling of paralysis and feeling very foggy despite not having much to drink, right? And so we focused on that piece. And then our Good Samaritan policy, which again is not something unique to Boston University. Many other schools have this because certainly for our student population, not getting in trouble is the main issue that they are concerned with. So unless our students feel that they can reach out and say, I'm underage, I was drinking, so was my friend, here's what we saw, we're not going to understand how big of a problem this is. So before I turn things over to Detective Lieutenant O'Connell, I would just say that one of the questions that was posed as part of what higher ed can think about in terms of how can collaborations across the city occur. I also posed this to our Boston Consortium partners, and I think the resounding response is, one, partnering together to raise awareness, to provide harm reduction in a non-victim blaming way, and to know where you can go to get help. Making sure that our messaging is consistent and trauma informed is really important. And I will tell you, this is hard to do perfectly. Even after we've put out messaging, we've heard reports, we've seen remarks on Instagram, why don't you tell men to stop raping, right? Like, this is difficult to get this messaging right, but we are certainly trying, and we are learning from experts across the city and at our own university. The other piece that was mentioned, I think Lieutenant Detective Driscoll mentioned about emergency departments. In some ways, we feel, or I feel like this is a little bit like COVID for higher ed, where we couldn't have testing at first, so we didn't know how much of a problem this actually was. And emergency departments are flooded with other illnesses that have now continued to creep up at unseasonable times. So we call to almost every nearby emergency department every few weeks asking, are you providing testing? Is that testing not just a traditional tox screen, but is it actually for ketamine and rofinol and GHB and other, designer drugs? And I'm happy, not so happy, to learn about gleaning. I hadn't heard about that before. So there are toxicology screens, but if they're not the ones that people are using and it's not in a timely fashion, it can be hard to detect this. So I think that is a hard message for emergency departments who are inundated with other very serious concerns that are coming forward, to figure out how we can support them with fast, easy, accurate testing. And although urine strips are out there and you can buy them on Amazon, serum testing, as far as I'm aware, is really thought to be the more accurate form of testing to really be able to understand if someone has been the victim of drink spiking. Thank you all. Detective Lieutenant O'Donnell, I'll turn it over to you.
Yes, good morning, everyone. Thank you for inviting me today. Just to give you some background, I have been here at Boston University for about 3 years. I supervise the detective investigative unit here at Boston University Police. Prior to that, I worked for the Boston Police Department for 33 years, and 13 of those years were at the Family Justice Division, where I supervised the human trafficking unit, as well as worked in the sexual assault unit for close to 9 years. So understanding the issues of how prevalent the issue of alcohol and the question of drugging coming to sexual assaults, and the inability sometimes to really get clarification as to whether drugs was utilized or not, due to the fact of testing has to be done within a certain time frame in order to really identify what is in somebody's body system with victims who have reported. So understanding all that, it's an important issue that we're seeing here over the past year and a half. Working with Rich Driscoll with Boston Police and his unit over there, and what they have been investigating. Clearly, it was something that we at Boston University saw that a need to make sure that we're trying to get out to our partners, whether it was with student health services, as well as SAP here within the campus, and getting information out to our students in terms of making sure they're aware of this issue that has been going on. And we've done that through our social media formats here at Boston University. We're working closely with Boston Police and other municipalities that surround BU, as well as our university basin group that we meet monthly on. We've been speaking on these and exchanging information on our reports. I can tell you that for Boston University, our reports have a low number over a period of 3 years. We have probably a reported number of 8 potential spiking or drugging matters that we have followed up on. All of which have occurred off campus. But I can surely tell you that I'm sure that the low reporting number here that clearly there's probably some that are going on campus that we're not aware of.
Sorry, Detective O'Connell, I'm having a little trouble hearing you. I'm not sure if there's like a slight echo, but just
Okay.
Yeah, that's
Can you hear me? Okay.
much better.
I'll get closer. So just but I think highlighting what Dr. Judy Platt talked about is what we're doing also is just making sure that our officers are aware of what they're seeing for symptomology, particularly when we're interacting with students in some of our alcohol calls that they're responding to, knowing what the symptomology about the loss of body control, the paralysis, highlighting what the symptoms are that could identify a potential for that needs to be a follow-up investigative unit of our university. And that's what we've implemented with our department-wide, so that if there's an indication that there is simply more than just overconsumption of alcohol, notifying the investigative unit so that a response to that victim, whether they go to the hospital or follow up with them if they choose not to have follow-up. That's again an important part. Our victims are willing to go to hospitals and be seen in a timely fashion. That's a factor that also weighs into the problem of trying to get good, accurate data. So I think we're all collectively working together as a team approach through the multi-agencies that we're all seeing here on today. So I think we're in a positive mode, and also identifying for the response to the ER. Clearly, it's an issue with ER staff. They're not the investigators. This isn't their mantra for following up on investigations. It's a police response. So I think that has been put into play as well with Boston Police in terms of their investigators are responding to any identified case that they come across is doing follow-up for an investigative approach. And that enhances the medical side in terms of what we can ask or request for testing. So, but I think we're in the beginning stages of just pulling pieces and data together. And I think collectively as we go forward, just making sure that communication across different entities is in fact communicating. It's a little difficult with the medical side in terms of HIPAA. That's another issue here, but I think collectively working, I think we're on the right road in terms of trying to identify and quantify what actually we have here. I think we're just in the beginning stages.
Thank you, Lieutenant Detective, obviously Dr. and Platt and Kenny Ryan, and also thank you to BU for taking the lead among colleges and universities. So it was great that Councilor Coletta reached out and you guys answered the call. And I just want to shift to the last panel we have here. Alana Turco is here, Chief Strategy Officer from Leader Health, and that'll be followed by Jessica Morani and when Alana concludes. So you have the floor, Alana, if you can just introduce yourself and a little bit about your organization. Give us your thoughts.
Morning. First, thank you so much to the co-sponsors, Councilors Coletta and Lujan, for your commitment to this work and drawing attention to its urgency by calling this hearing. Again, good morning, everyone. My name is Alana Turco, and I serve as the Chief Strategy Officer at Leda Health, a female-led healthcare company created by and for survivors of sexual assault. I myself am a survivor. We serve as a resource to survivors to support their healing in whatever ways are most meaningful to them. Centering survivors and taking a trauma-informed approach, we partner with anchor institutions to raise awareness and acknowledge societal culture of sexual violence and rape culture. As Lieutenant Driscoll mentioned earlier in the hearing, as of the beginning of October, Boston Police have reported 73 allegations of drug drinks this year. And also, as Lieutenant Driscoll mentioned, that dark figure of crime is so true, because the reality is that the number of people who consumed contaminated beverages is likely far higher, since we know that many survivors are hesitant to come forward due to feelings of shame, fear of retribution, trauma, and a variety of other reasons. It is our goal in joining today's hearing to determine how we can jointly combat this unacceptable scourge by taking concrete action to prevent the contamination of beverages in Boston. As we all know, the so-called spiking of drinks with drugs is often used to incapacitate the victim before sexually assaulting them. While it's difficult to produce an exact figure on the prevalence of date rape drugs, as many have mentioned already today, because these drugs are sometimes challenging to detect, an analysis of a rape treatment center in San Francisco estimated that 1/3 of sexual assault cases involve date rape drugs. So it is critical that we're doing everything in our power to mitigate these crimes contributing to the ongoing sexual assault epidemic, such as drink spiking. We are encouraged to hear that here in the city of Boston and among the institutions represented here today, we are not placing the blame on victims. It is never the responsibility of anyone to prevent their own assault or victimization. The most important first step is education. For example, adding safety awareness signage and educating bar staff on the common signs of contamination would be a good first step. It is also key that we identify preventative measures such as perhaps lidded cups and other innovative solutions. Considering Boston's significant college student population, we should also have awareness programming and workshops on college campuses across the city. Further, we must address the cultural elements that make bad actors think that this type of harm is acceptable and that they can act with impunity. It's critical that we consider the resources available to victims to ensure they have options to preserve potential evidence and access support in the event of victimization, especially sexual assault. Some of the supports that LEDA can provide in partnership with others, include educational workshops, early evidence collection kits, STI testing, and emergency contraception. We are also working to incorporate toxicology screening into our suite of services. We can also install physical boxes within establishments and on campuses that not only serve as point of access, but raise awareness in the community that drink spiking and sexual violence are not tolerated here. Such installations can also make reporting easier. Together, I'm confident that we can identify solutions to ensure that Boston venues are safe spaces for everyone. It's only through discussing these issues and bringing them to the forefront that we are able to make concrete progress towards prevention. Thank you.
Thank you very much, Alana. And I see that we've also been joined by David. David Rennie from Boston Area Rape Crisis Center. David, you have the floor. Welcome. If you could just give us your thoughts.
Thank you so much, Councilor Flaherty, for members of the City Council, Boston Police, and the other agencies and advocates this morning. Particularly happy to see such a strong showing from BU, my own alma mater. My name is David Rennie. I work with the Boston Area Rape Crisis Center, or BARC for short. Thank you, Councilor Lujan, for mentioning our hotline earlier and the resources that we provide for folks. BARC is our local regional rape crisis center. Our mission is to end sexual violence through healing and social change. We've been supporting survivors in the greater Boston area of sexual violence and their families since 1973. All of the services that we provide to folks are free and confidential, and we know how important that confidentiality can be at times for the folks we work with. People looking for more information about the types of services that BARC can offer certainly can check out our website, barcc.org, or call the 24-hour hotline, which the councilor mentioned before. I'll just mention it one more time here, 1-800-841-8371. One particular note in terms of some of the services that BARC provides that may be relevant for this conversation, BARC is also the agency that runs the statewide Access to Forensics Information Line. which is the special hotline that survivors can contact to get information about the results of their sexual assault evidence collection kit, and also some of the toxicology kits that the emergency rooms can do with survivors around the area. And that line may provide some important information for folks who decide to go to the hospital. There are sort of two issues that we think are really of deep importance in this conversation. The first, obviously coming from BARC, is what kind of support folks who have been affected by contaminated beverages can access, especially if that experience is then followed by some form of sexual violence. BARC provides a set of support services, including in these cases accompaniment to local emergency rooms for survivors who decide to go for an evidence collection kit. One of the voices that the City Council may be interested in contacting, if they haven't had the chance to do so already, are the folks at the Sexual Assault Nurse Examiners Program, who are the nurses who are specially trained to do the evidence collection kits that are done in the local area hospitals. A component of those kits for many survivors who feel that may have been drugged may be some form of toxicology testing. So that may be an option to get some additional voices as well. But considering sort of what the connections are between the various organizations that may work with a survivor who's been affected by contaminated beverage, and where are they being directed and connected to? Are they able to access, for example, BARC's hotline or some other form of support line? Are they able to access follow-up counseling and support? Are they able to get access to a hospital? There's a time frame in which folks can usually get to a hospital for one of those evidence collection kits if they decide to do so. Are they in a space where they're able to connect with other agencies or entities that will provide them with that information? BARC is always happy to do that sort of thing, but not everyone knows BARC exists or has access to our resources or our hotline if they aren't aware that BARC is out there. So that's one issue, is what sort of support is available for folks after they've been affected? Are we ensuring that support is trauma-informed and comprehensive? And then the second question is, what sorts of tools are available for effective prevention? BARC has worked at times in the past with our licensed establishments, with bartenders and waitstaff, to do bystander training so that we can get staff in those agencies or in those establishments better equipped and more comfortable with the idea of intervening before something happens. Obviously, that's putting a lot of onus on the staff in those entities, but there are some promising practices as far as doing bystander training and intervention training there, and there may be some room, especially if the chief is going to be pulling together a task force or a working group to think about what some of those trainings might look like. And my colleague, Casey Corcoran, who was originally slated to speak today and unfortunately is out of state traveling, as our Senior Director of Community Outreach, Awareness, and Prevention Services. It does a lot of that work, and I'm sure BARC broadly would be very excited to be a part of any of those types of task forces. Finally, to conclude this morning, BARC doesn't have any sort of data or additional information about the prevalence of contaminated beverages beyond what Lieutenant Detective Driscoll provided. Survivors don't have to disclose to us if that's something that they've experienced in order to access our services or in order to connect with us. Anecdotally, we know certainly at the beginning of the year, the beginning of the academic year, the number of cases that our team has called out to provide accompaniment for at the hospital does go up. And that's a well-known sort of phenomenon across the country, that when academic years start, colleges come back in session, that there are a lot more of those cases for a certain period of time. We are happy to be partners with the city and other agencies ongoing to make sure that survivors have the support they need, and that whatever sort of prevention efforts BARC may be able to assist with, we can assist with. But our main thrust is to ensure that survivors have the support they need and that they get the backup and support that they deserve after an assault. Thank you for having me this morning.
Councilor Flaherty, you're muted.
Thank you, colleagues. We're also joined, thank you, David, obviously. We're also joined by Jessica Maranian, Director of Government Affairs for Mass Restaurant Association. Jessica, obviously, is I guess, chair's prerogative, but are you the same Jessica I talked to every day during the pandemic?
I am.
Let me just, on behalf of my colleagues, on behalf of the residents of Boston, you have no idea how many people you helped throughout the entire pandemic. You worked every day, including weekends. We talked all the time. My staff was coordinating with you and your team. Great to meet you, obviously, personally, but I'm sitting there and I looked at your name and then I started to say, is this the same person? You were an absolute all-star throughout the entire pandemic. I cannot say enough on behalf of my colleagues and colleagues calling me, reaching out to you. Every sector, hotel workers, restaurant workers, cooks, folks in the travel, tourism, transportation industry, you were absolutely amazing. You saved people, frankly.
Thank you so much, Chairman Flaherty. It's my pleasure.
I wanted that had to be noted here. I know that we're going a little off track here, but I cannot stress enough throughout the entire pandemic. It was a pleasure to work with you, but the level of assistance you provided residents of the city from every corner was absolutely amazing. And I obviously let folks know in other parts of city and state government the great work you did. So I would be remiss if I did not highlight that before we continue this very important discussion. But it's a pleasure to meet you, and I can't thank you enough. So, and you have the floor, Jessica, on this topic. And MRA is lucky to have you.
Oh, thank you very much, Chairman Flaherty. I know we hadn't had the opportunity to meet face to face. We had talked during the pandemic, but I really appreciate the opportunity to speak to everyone today. Good morning, Chairman Flaherty and other distinguished members of the Committee on Public Safety and Criminal Justice. For those of you who I have not had the opportunity to meet yet, my name is Jessica Moradian, and I serve as Director of Government Affairs for the Massachusetts Restaurant Association. I want to thank you for the opportunity to testify today. Mostly I'm here to listen to what the public safety experts have to say, and also obviously to offer a few comments. Restaurant, clubs, and bars are diligently working to make sure that customers are safe when they are in their establishments. In 2019, the city and industry authored a report outlining best practices in public safety in nightclubs and other licensed premises. This is that report, just so everyone knows, and if anyone needs it, we're happy to share it. In this report, best practices for security, planning, intoxication, and responses to crimes and serious incidents are outlined, among other best practices. Our members have taken these best practices to heart and are tireless in their safety training operations. They have security measures in place to prevent the contamination of beverages and are proactive in detecting unusual behavior in order to prevent an incident from occurring. Many will also not let an intoxicated individual leave an establishment alone and require a friend or family member that is taking an intoxicated individual from the bar or nightclub to share their ID for records. In recent discussions with operators' security staff, it has been made clear that their teams investigate allegations of improper behavior, including any allegation of possible drink contamination. Additionally, staff are trained to monitor suspicious behavior and characters and are available to help patrons should they need or ask for assistance. Frequently, operators make drink covers available to customers and have signage displayed letting customers know that drink covers are available if they would like to use one. Additionally, security teams do pre-shift meetings, walking through policies and procedures and updating staff on incidents that may have taken place recently. Police-community relationships are very important in prevention as well. Operators need to have good relations with law enforcement. Our operators strive to have good relations and this includes timely reporting of crimes if one were to happen. Management is also prepared to assist an individual that is reporting a crime through the process of reporting the crime to authorities. There are also measures that an individuals can take place to just be on the defense in a nightclub or bar atmosphere. Best practices, as we've already heard, include but are not limited to staying with a friend, never leaving a drink unattended, only accepting a drink from someone you know and trust, drinking water to remain from intoxication, carrying a minimal number of belongings so that you do not lose them or have them stolen. And always stay with friends that you came with. We at the MRA would like to commend the work that the city is already doing and are happy to partner to keep guests safe. Again, thank you for the opportunity to testify before you today. I look forward to continuing to listen to law enforcement on ways we can keep everyone safe, and we are happy to continue working with everyone. Thank you very much for this opportunity.
Thank you, Jessica. Thank you for your partnership. I'm going to turn it right over to the lead sponsors to get into questioning of our panelists. So start with obviously the lead sponsor, Councilor Coletta, followed by Councilor Louis-Jean.
Thank you, Chair. And I just want to thank everybody for providing your perspective on this very serious issue. I want to be careful, just making sure moving forward in this conversation that we are respectful to victims. Again, just calling that out there as a PSA, but just wanted to show my gratitude for your work in preventing the very worst from happening to our residents. And I have a lot of questions, so I will reserve my questions first for the administration panel, and then maybe go to the next round, being respectful to my colleagues, just to ask questions about the higher ed and the advocacy groups. But my initial top lines and takeaways have been the need for awareness programs and workshops, better outreach to everybody, bystander training, financial support for preventative measures. Thank you to Chief Adwowu for that commitment, victim supports, and obviously continued collaboration among all of us. And I think this conversation provided a good picture of what the situation is right now in terms of specifics and things that the city can do to help mitigate this issue. I did want to, I'll start with Lieutenant Detective Driscoll, and then go to Chairwoman Joyce, and then maybe go to Chief Adwowu for some follow-up questions. But sorry, I keep calling you, I want to call you Lieutenant Driscoll, but it's Lieutenant Detective Driscoll. I want to be sure to get your title right. But it seems as though that your emphasis, and from your perspective, is really that we need to bifurcate this issue. So with one branch being what is happening in colleges with lean or SISRP, I think is what it is. And then what's happening in licensed premises units. So this is the more traditional, I guess you can call it, for lack of a better word, instance of contaminated drinks. And in a bit, I do want to understand from Chairwoman Joyce how we can better thread the needle so we're not scaring away restaurants from reporting, and how that will materialize in some of the processes in city government. But for the Lieutenant Detective, can you walk us through a little bit more, just because I want to be able to set the stage a little bit. Can you walk us through what the process is when someone calls the BPD, when they believe that they or someone they know or patron has been drugged? So I want to know who is notified, what actions are taking place, and then more importantly, how is this reflected in our reporting or tracking system so that we could better see trends that's happening across the city? And then on that note, I'm curious to better understand where we are seeing this happen across the city, where this is popping up more so than other places.
Sure. So in terms of how the reporting happens, if someone reports that they feel as though their drink was spiked, or, in some cases you have someone who says, I had a drink, I have no idea what happened. Similar to what a lot of our panelists have mentioned. They just have no idea. So with respect to just that allegation, it would likely not come or rise to the level of my unit in sexual assault. So there's two different paths. If a sexual assault is mentioned, is made, whether it's to one end or the other, then we will take the initial report, follow our sexual assault protocol, which the responding officer takes a very minimal facts report, and then we follow up with the investigation and start the investigation from there. So with respect to that, that's how we'd respond to it. If it is just a drink spiking with no other accusations attached to it, the district detectives would follow up on that like they would with a burglary or any type of district level offense. With respect to some of the suggestions or issues with better reporting and the trends that we're seeing, we have check boxes on our Mark 43 system, which is our report writing system. We have all types of collate information into trends, but we don't have one for drug facilitated sexual assaults. We don't have one for drink spiking accusations, and we don't have a reporting mechanism that does it, automatically. Essentially what we've been doing, and, this really to the commissioner and to Superintendent Cologne and BIS, they've just tried to coordinate with analysts from the BRIC to keep a running total of these types of incidents right now as a means of tracking and as a means of trying to recognize if a pattern is happening. So as of right now, we don't have an official type of mechanism. And the importance of the mechanism is that it exists 24/7. It's not, subject to human error. So it can really collate the information. And then from there, the data can be analyzed, the metadata and all the other trends and all the information that comes with it. So that, from a departmental side, would be extremely helpful. Additionally, and I think, Judy Platt touched on it, Kelly touched on it, Kathleen Joyce touched on it. There is a difference between being drunk and drugged. So how we can get the data and the information to kind of peek through without, the help of electronic mechanisms and whatnot is better reporting from police officers. So if you look at drug arrests or whatever, if you took a drug arrest from 1980 and you would see these small reports with very, very little detail, rightfully so to judges and motions and kudos to defense attorneys and everyone in between. They said, we need more information if you're going to, take someone's Fourth Amendment rights, or if you're going to do something like that. So what happened was they needed more detail. So if we encourage officers to just put more detail into their reports and mention the type of things as, dead limbs, one drink, things that are specific to being drugged versus, alcohol consumption. There really are like two different tracks, and that can really help someone actually clarify the issue itself, to just say, because we've had in some of the investigations that we've had, speaking to someone and they say, wow, I didn't realize I drank as much as I did, and that happens too. But I think knowing it is really, really important for survivors. It helps them kind of own their situation. And that's one of the things we've seen. In addition to the funded
and really quick, I just want to be respectful to my colleagues. If I could just follow up on something that you just said. Sure. So what I'm hearing in terms of policy opportunities or some of the low-hanging fruit that we can implement now, and I don't know if there has been a commitment from Commissioner Cox or the BRIC, but there really needs to be a better way to, so first of all, better training for our police officers to identify the difference between drug-facilitated incidents versus somebody just being drunk. So that's I think, something we all can agree on, but then also that we need to be able to change, the Mark 43 reporting system to be able to intake this data?
Yes.
Okay, and there has been a commitment from Commissioner Cox to do this?
That I couldn't speak on. I think we've had discussions with it with the Bureau of Investigative Services. I know that the superintendent has begun to kind of put it in place and have discussions, but that's above my level.
Okay, thank you. And I do know that I would like to better understand where this is happening. So if there can be something submitted to the committee through the chair, if I could request that information of where a majority of these incidents are being reported, I would appreciate that.
Sure, absolutely. The 73 that I mentioned, those were for the licensed premise. There are other claims of ones such as like residences and things like that. And that's the second domain we were talking about with as far as, the college campus scene, or the college party scene, or the college scene. I'm not saying everyone is attending a college or university.
Thank you. Thank you.
And that's, I'm sorry, just to piggyback on that. So he's talking about 73 reports. I've only had 8 hearings. So it sometimes there's a lag between the detective finishing their work and it being assigned to licensed premise unit to then issue a licensed premise violation to then have a hearing. So sometimes we have to let the detectives finish their process. If there's a criminal investigation before they bring it before the board to see if there's responsibility on the part of the bar, if that makes sense.
Right. And I did hear that there was a barrier of a lack of proof, right? So testing kits and having access to immediate toxicology reports is a huge thing, both to hospitals and to restaurants. So that's something that I just want to call out as a strategy to try to expedite these investigations and providing you, Chairwoman Kathleen, with some proof or just as a way to get the ball rolling. And I do appreciate the fact that you have gone out to the community, that there's been 2 community meetings, especially one in East Boston. Thank you for that. I did hear the need to increase outreach to patrons and venues, and also training. Is this something that the licensing board can do, and do you have the capacity to provide these trainings? Is this something that we need to bring in BPD or other outside organizations to help bartenders and restaurants?
Well, our licensed premise unit consists of 3 Boston police officers that cover the entire city. So that's a good question. I think we could probably tie it into the stakeholders meeting that Chief Idawu talked about earlier. We've had some citywide meetings. I think it would be great to get some of the larger licensed premises together with some of the smaller licensed premises to identify best practices and things to look for. I think a big thing is when this happens in real time, if you're with your friend, I think your first reaction is to help that friend go to a safe place. It isn't necessarily, let me grab the manager in Boston Police. So we're trying to alert and train and identify those signs within the licensed premises, so management is looking for them. Mm-hmm. And to that point, to what Lieutenant Detective Driscoll is talking about, helping these detectives in the licensed premise unit write up these reports in such a way that we have something to act upon. So it's coming at it from both ways, coming at it from in real time when it's happening, and then afterwards when they write up the reports. There is a lag. We don't want to get in the way of a criminal investigation. At the same time, we want to continue to get word out for public safety purposes. Mm-hmm. We have talked about signage. A lot of restaurants on their own have put signage in their bathrooms, at the front doors. I think you'll find that the Faneuil Hall restaurants and bars, they are on top of this. They communicate with each other from one licensed premise to the other. If they are concerned about something, they share information. And we're trying to encourage those same sorts of communications in the different neighborhoods in East Boston and South Boston. What are you looking for? Is there somebody that you're suspicious of? Keep those lines of communication open. And from what I hear, that does happen.
Thank you. And Chair, I just have one more question for the chief. And also just thank him for supporting our restaurants and bars financially, and that commitment that you had mentioned in your opening statement. Do you think that within this commitment, there could be, or there is a willingness to provide maybe technical assistance for camera installations along our bars? Or would it just be limited to things like scrunchies that are also cup covers and some small preventative measures like that? But would there be an openness to explore that with restaurants through this task force?
Absolutely. I mean, the money piece was to make sure that we at least have a pot to pull from in order to support venues on this matter. There could be other things that come up in the meeting and subsequent meetings that we have beginning next week. So I just mentioned the lids as one example, but for sure we'll be able to help in terms of cameras, technical assistance, as you mentioned. This is also a supplier diversity. I hate to use the word opportunity, but we also want to make sure that other local companies are able to participate in helping keep Boston residents safe.
Thank you. Thank you, Chair.
Thank you, Councilor Coletta. And just a quick follow-up on that. Of the 73 reported cases in 2022, and I don't know if this is to Lieutenant Detective Driscoll or to Chairwoman Joyce, were there any repeat customers, if you will? Was there one establishment that had like 12 incidents or 5 or 15, whatever the range is, but any sort of red flags that said, hey, this place, maybe we might want to dial in, and they might have some business practices or some activity that maybe the Boston Police could set up a sting or something like that to try to catch this, or maybe no, maybe the 73 were sort of spread around the infield, I guess, but I'm just curious on that front.
Anecdotally, I hear that, based on social media, but of the 8 that we have public hearings on, there are no repeats.
Okay, that's interesting. Chair recognizes City Councilor Root Seat, Louisiana, co-sponsor.
Thank you, Mr. Chair, and thank you again, everyone, for being here. Councilor Coletta asked a lot of the questions that I had in my mind, but I just wanted to ask, I think, 2 questions. One to Lieutenant Detective Driscoll, something you had talked about, which really piqued my interest, is the idea of potentially having these Good Samaritan exceptions for these licensed premises and reporting. And I just wanted to, if you could talk a little bit more about what that could look like given the current state of regulation.
Sure, yeah. So, it was recently implemented over the last few years with respect to drug overdose laws, because we had reports and instances where someone would actually die of a drug overdose, and the person who was with them had run away or left the area, and it was because they were afraid of being arrested for being in possession of drugs. And obviously, the more important act would have been calling the police or calling 911 to get medical assistance in Narcan. So that same philosophy exists with respect to what we're kind of talking about with the licensed premise. And this is just more or less just a suggestion, because for what it's worth, the licensed premise organization, the Boston Police Department, and Kathleen Joyce, they do a fantastic job, and they've really been kind of pushing us on this as well. And it's been a push and pull a little bit, really, really communicating and really, really recognizing this issue. So with respect to that, I just want to make sure it's not a criticism by any means. So
just so you know, I didn't take it as such. I just think that if there are ever any areas, right, like regulation is good in a lot of instances, but if there are times if we learn that there are areas where we can be maybe help solve a public policy problem by peeling back a layer of regulation or something like that, I think we should explore it.
No, I agree. So what I see is when you talk to bar managers, or you talk to bartenders, or you talk to anyone in the industry, they are reluctant to call, I guess, sometimes because of, they don't want to go through the process of getting a licensed premise violation and having to go to court for it and potentially face a fine. So, as Council Flaherty mentioned, a lot of times they'll just toss them out the back door. So with this being such a serious issue, and where you could potentially say, oh no, you just overserved this patron versus they were drugged, they have a legitimate consideration of whether or not to report in their mind, because they could definitely face a sanction for overserving. So that's really what it speaks to, is that case in those type of instances. So I would say maybe if we could just streamline it specifically towards someone being, a certain circumstance and applying a Good Samaritan exemption or something like that to increase reporting. I guess that's hopefully that answers your question.
Yeah, and I guess to me, what I think I was getting at, and I think that does, is that do we need to, we're thinking about potential solutions, do we need to change something that's codified, or is it, like you said, is it just a philosophy in these one-off instances that you think will be sort of more effective? And Kathleen, if you have any thoughts too, feel free to happen?
Yes, so to piggyback on what Lieutenant Detective Driscoll was talking about, if an alleged crime has occurred at a licensed premise, the licensed premise unit follows up and writes what we call a licensed premise incident report. We don't issue monetary fines. There are no fines. We have what we call progressive discipline. So, and we take a hard look at that. We want, one, our primary goal in a case like this would be public awareness and public safety. So we hold these hearings for many times just to get the word out that these things are occurring and to let the public know and to let licensed premise know. As I said, we had 8 hearings over the last year, not one of them resulted in any sort of progressive discipline because we did not find responsibility on the part of the licensed premise. 2, happy to work with our licensed premise unit. I know there are certain rules, Boston Police rules, as far as who can write up a licensed premise incident report. I believe it has to be a detective or a superior officer. So if someone goes to the local police department on a night that they think they were drugged, you can't always have the officer duty that night go and write the police report up. So sometimes there is a process, so there is a little bit of distance there. And I'm not completely conversant in the Boston Police rules, but that's what I understand. So we hold these hearings on the alleged druggings as a public service in many ways. We want the public to know about this. So that's what we're trying to do. We're trying to dispel the myth to the licensed premises that you're going to get in trouble. You report this to the police, because it's not true. It doesn't cost anything to appear before us and defend yourself before the board. And we use it as a tool to communicate to the public and to other neighboring licensed premises that we're seeing these issues in their neighborhoods. And we work really hard to turn those types of hearings into informational gathering, trend gathering, and to get and we found that every licensed premise, they are scared. They come before us to go, oh, it wasn't our fault. We don't have any proof. And I said, look, we're going to talk about it at the hearing, and that's what the opportunity is there for. And I could see if a smaller restaurant received one of these, that they would be concerned, they would be held responsible for someone being drugged, but we talked them through it. We managed their expectations that they could be part of the process and part of the solution. It's not necessarily seen as an antagonistic process.
Okay, thank you. And that, I mean, that relates to a question that I sort of had for the MRA, which it's not really a question, but just like on the idea of training and how we train establishments and bartenders and bouncers, and the idea of sort of how do we sort of remove some of that fear in reporting in the process, like number one, being able themselves to watch out for signals, but also number 2, prevent that sense of fear that may arise if they, if they report an incident. So I'm not sure, and I know, I think in the past, BARC used to lead these trainings. I'm not sure if the city does as well, but BARC, I mean, I'd love to sorry, I'll stop.
Sorry about that. I have a delay, I think, but we did learn at our citywide meeting that some of the downtown Faneuil Hall bars do have video training modules that they, I think, maybe participate through some restaurant association that train staff about looking for these signs. I know Sissy K's in the Hong Kong, their management team is very well versed in these types of things. And we learned more from Bill Johnson at Sissy K's than I ever learned about this issue anyways. He's about 2 or 3 steps ahead of anyone as far as what to look for drugging and how to train staff. So Bill has been a good resource to us, and I'm sure we could share that information with others better. We could do a better job at that.
Thank you. And also just wanted to thank Jessica for being here. I think it's really important to have industry as part of this conversation, to really think about how we, I am a big proponent. I want to see Boston's nightlife. I want us to see like a vibrant, fun, inclusive diversity for everyone. I'm really excited about Chief Idowu in the position of the nightlife czar. If I could have that job as well as being a city councilor, I would do that. But I just really think that we all sort of need to like play a role here. And I think that we need to find ways of calling in. I'm a call in instead of a call out, especially when we have like a big issue that we're trying to solve. So Jessica, if there are ways that we can be more thoughtful when it comes to bringing in a lot of these bars, especially around college campuses, especially in the Faneuil Hall area, in partnership with BARC, maybe we do like an awareness campaign day where we bring everyone together. I think that could be great. And then my last question is actually for BPD again. Is there a dedicated line for victims and if they have have an issue that they could call, is there a dedicated line at BPD, Lieutenant Detective Driscoll?
In terms of drink spiking?
Yeah, drink spiking, or I guess with respect to this general issue, is there a line that they could call to talk to someone within BPD?
We do have our community engagement office, which, they're pretty good with engaging, with people on an array of topics. But specifically, I don't think we have anything specifically dedicated to this. We take it on a case-by-case basis from an investigative role. So as far as I know, I don't think we do, but we may.
Okay, thank you. To me, when I think of community engagement, I think of like other efforts that the city or BPD needs to be strengthening, like what you talked about, community policing. To me, I think about how are we ensuring that we are putting enough information out there so that folks who are otherwise, this is a very difficult area for people to come forward and feel comfortable speaking. And so I think if we don't have a dedicated, it would be good to explore whether we have that dedicated line and think about creating one so that folks have somewhere they can go within that they feel safe. And if that's not, if we decide that that's not the best purview, I think BARC. I know that BARC has a hotline, and that obviously I gave that number in the beginning, and that's a helpful resource. But I'm just trying for us to be more intentional about the resources that we have internally that we could bring to bear. So just a point for us to really think about and explore. Thank you, Mr. Chair. I'm going to cede the floor to my other colleagues at this moment.
Very good. Thank you, Councilor. Chair recognizes City Councilor Kenzie Bark.
Thanks so much, Mr. Chair. I guess one thing that the last exchange had me thinking about was whether we should have, as a supplement in addition to all of the stuff that the police are doing, like some kind of, basically some kind of reporting thing, whether it was like, Councilor Lujan mentioned a phone number, but even like a place to type in a report of like, hey, I think I got roofied a few nights ago. Cause I'm just thinking about that's the way that we've heard about it in our district has tended to be by people posting on social media, like, hey, other people, watch out. I think this happened to me at this venue. And so people are doing that already. They're doing it on the various pages of establishments. And I know that I'm sure it stresses the establishments out. But I think that's part of the point, right? Is that if we heard from 3 or 4 different people that they thought they were experiencing something at a specific place, without even having a police report, without having an actionable thing where Chairwoman Joyce could actually sanction a bar, I feel like that would be enough for any establishment to be like, oh, we want to look at our protocols and we want to kind of think about, maybe they're not on the train the staff boat yet and they could get on it. So I'm just thinking about whether part of identifying this as a city issue is saying hey, if you think you might have experienced this in the city of Boston, here's a brief form to type in your report. And like I said, it doesn't become a kind of actionable legal thing. We have our other processes for that people can pursue. But just so we're collating some of this data, because I remain convinced that any establishment that finds out that this is happening on any kind of repeated basis is going to want to solve that problem. And I just think that if bad actors, they think that there's a place they can regularly do this and they just find it hardened, like the detective was saying before, that's going to be one of the more effective ways of discouraging. So that's sort of more of a proposal than anything else. But and if any of the panelists have any thoughts in response, but I just feel like that's what everyone's comments have sort of made me think about.
Councilor, I appreciate that proposal. And if it's all right, I do want to bring that to the larger group that we're convening next week, but to also talk internally with some of my colleagues, because I'm also, to that point, thinking about if there are existing apps that the city controls where we can utilize them for people to report, so of course, after reporting the emergency to the police, but as a way to kind of crowdsource information of friends or others that are in these chat groups are seeing more of these things being reported that are not getting to the police, that at least to your point, we're capturing that information, but using the phone, right? As opposed to creating a different form that might be on boston.gov that not everyone may not know about. So yeah, I'd love to take that back to our colleagues.
Great, thanks so much, Chief Idu, and I'll leave my questions there, Mr. Chair, in the interest of time.
Thank you, Councilor Bach. Chair recognizes Councilor Julie Mejia.
Thank you, Chair, and thank you to the sponsors for bringing this to light. I just have I don't know if you can hear me. My background is weird here. I just have two questions. One is actually a question, and the other one is a consideration for us to have as I love public hearings because they give us an opportunity to bring our best ideas to the table and to listen to each other and figure out what we can do collaboratively. So I'll start with just a quick question. If anyone could tell me if this is something that we're seeing widespread across the city or if it's isolated areas. I believe it might be in isolated areas, but where there's a lot of college students, but I'm just curious if any of this has spilled over into other neighborhoods.
Yes, I have heard anecdotally that it has spilled over into neighborhoods, hence why we went out to East Boston to talk to the licensees there at the request of Captain Bickerton, and we have also seen it in South Boston. I have heard about it in my own neighborhood as people contact me. But we have not seen them appear before the board necessarily in droves in those neighborhoods.
Yep, thank you. And so it would be helpful as we continue to, provide traction to this, if there are things that we're seeing across the city as an at-large city councilor, however I can be helpful, please. I'm raising my hand here, Kathleen, put me to work. Let me know how I could be helpful in any capacity. And especially in regards to language and interpretation, just to make sure that, there are a lot of other, businesses that are operating whose English is not their priority language, that there is a mechanism in place to help communicate these issues to these types of businesses. I'm assuming yes. I see you shaking your head.
Yeah, when we went out to East Boston, we were lucky enough to have a translator from my staff and from the police department. So we were cognizant of that to make sure the communication was clear. But I appreciate your help, and we will definitely reach out.
Yeah, please do. And then this is more of a suggestion, just more along the lines around the communication and engagement. So sometimes we tend to focus on the industry or the folks who are being impacted, or maybe the entities and where folks are more likely to be convening. But I think that as we continue, Lieutenant Detective, wow, that's two titles there. I can see why Councilor Coletta was like, I want to make sure I get it right too. I think nail salons, barbershop, those are my people. I always bring them into every single public hearing that I have because they are the best source of helping to get information out. So if there's any, public awareness message or anything that you want to share, I think tapping into some of the local businesses that are across the city of Boston, where people frequent, which is the barbershops, the nail salons. People get cute before they go out, so it's a good place to share some information out with the public. So I would recommend that those might be good outlets for you all to consider in terms of outreach and dissemination of information. So just wanted to offer that. And because our office is so connected to so many barbershops and hair salons through the work that we've done with them during COVID, I'm more than happy to send a list over of folks who you can, drop materials off to or whatever is helpful. But I do believe that those folks are really good at sharing information. And even if you are community with some of the owners that, you know, while somebody's getting their hair done, they can just say, hey, you know, I don't know if you've heard about this. Not to put extra work on them, but I just think that in terms of getting the information out to as many people as possible, that tapping into some of these businesses would be a great way for us to build that connection. I say y'all lucky. I'm not yelling at anybody today. I don't have anything to say or any about you guys, but I'm going to cede the rest of my time because I know we all have an activity at 12. So thank you so much. And if anyone has any comments, questions, or, you know, affirmations for the comment that I just made, I'm more than happy to listen. If not, no worries. Thank you so much.
Well, Councilor Mejia, this is Shagun. I just want to thank you for that suggestion, and it's duly noted. So certainly on our end, we can use our relationship with the 40,000 small businesses out here in the city to get this information out to them through all the various channels that we have, and then also coordinate with the main streets to include this in the package of information that we share with them every week. So you're absolutely right in highlighting that. Thank you.
Yeah, thank you. You gave me another thing to say, so y'all better shut me up. Don't talk after this, but one more thing that I wanted to just offer too is that even looking at our departments, so sometimes we just focus on very specific departments, but you know, there are other city departments that can also help support the neighborhood liaisons. You know, our staff always goes to civic association meetings. So these are spaces and places where we can also disseminate information. So I would lean into, you know, all of the folks. There's the city on the truck that is going to be out throughout these streets. So if there's anything that we can disseminate, just share with us and we'll get it out there. So thank you. And I promise that was the end of it. Thank you.
Thank you very much, Councilor Mejia. I know, just want to be sensitive of everyone's time coming up on the 2-hour mark. I do know that I believe we have some public testimony. If I could just ask guests just to stand by. So Megan and or Christine, if we can facilitate the public testimony via Zoom. Now would be the time to do that, to get some public comments.
Excuse me, Mr. Chair, there are also, I know that there are advocates here. There's Alana here and there's Dave. If we had questions for them, did we miss that opportunity or will we be able to revert back?
Sure. If you have, so I believe we have 2 or 3 public comments, and then we could go back for a second round of questioning to some of our health and restaurant folks if our colleagues have those questions. So,
sounds good.
Megan, you're welcome, Councilor Louisian. Megan, can you facilitate?
Yes, I'll put the first person in. Ayana?
Alana, this is City Council Michael Flaherty. Welcome to the Boston City Council hearing in the Public Safety Committee. If you can hear us, if you could just identify, please state your name and any affiliation you have for the record.
Thank you so much. Thank you so much for all you're doing. I'm so appreciative of all your efforts. I do feel a little bit like I'm preaching to the choir. I'll be as brief as I can. I'm 56 years old, a beloved Boston City resident for about 15 years now. And I was drugged. I'm not going to say the name of the place because I don't want to blame them, but I will say that it was a horrific experience. I do feel that the club, I do feel a little bit pushed to the curb. I did thankfully have friends with me. I don't drink a lot. I hadn't had very much to drink. And the things that I think that we need is that there are no clearly defined standardized processes and protocols, as we've kind of touched on today, or as you've touched on. Safety needs to be a priority, and even things like signs in the bathroom. Well, by the time I got into the bathroom, I was screaming and throwing up and unable to read anything and stand. We need standardized processes for the restaurants and bars about how to deal with things in a way that they aren't afraid for liability, because that's the feeling I got. I was pushed to the curb. I did have people take care of me, but they really were extremely unresponsive following that. And my reach out to them was, do you have security cameras? And in the name of community, let's work together, not this is your fault. As we have rape kits in hospitals, we need roofie kits. I did go to Mass General. They took care of my symptoms. I'm so thankful. But my husband insisted they take a urine sample, which is now with the police. I'm told that it will be 2 to 3 months before we get any response from that. And they did not take a blood test. They said they don't. So there's no roofie processes in hospitals. I would say also that some of my ideas, which expand upon what you have wonderfully suggested, is first of all, by the numbers. You said there's 75 reports. I bet there's 75 a day. Even the night I was there, I'm a musician, and I was told there were a few other people who couldn't walk out on their own. Since I was on Channel 5, I've been reaching out to all my musician friends. I'm a performer, and warning all my friends. I have had so many people told me they have been roofied. Not a single person beside myself ever reported it. And some of them broke my heart. They were raped many years ago and never spoke up, never told their partners until they told me. So I speak for them today. So here are my practical ideas. We all know this is a problem. One thing is regarding the drink lids. It's the place that I was at, they're all plastic cups. That's great. Let's get the alcohol companies who love to spend money on swag, put their name on it. That should be instantaneous. That doesn't require government legislation to change processes. Number two, when anyone leaves an establishment and they may have been either overserved or it was their whatever, they can't stand on their own. I'm saying go old school. Let's put together, and I'm a writer, I'm happy to help, a business card that says, if you think you have a problem with alcohol, if you think you need help, let's not make it if you think you've been roofied. Let's do 3 or 4 things on a business card. That does not cost a lot of money, so that someone has it in their pocket. I am a strong woman, and I'm trying to get PTSD therapy, and it takes a lot of energy for me to write this. And so make it easy for people to report things by having business cards throughout the state. And we need to work together as a community. There aren't enough public service announcements on the television. And these are, going with a buddy doesn't always help, because many of the people are with someone else and 2 of them get roofied. I love the Good Samaritan suggestion, because I think that the place that I was, and as I said, I'm 56, I was the average age, I could tell they just have been very unresponsive, which has been upsetting. Just so you know, there's a Facebook group with 7,500 members. It's 5 months old, only about roofing in Boston area establishments. We need to all work together. And also, one more thing is, I am somebody, I would be willing to go 1 night a month as a volunteer. If we could have a simple training program where I just go, obviously no drink, and look around and keep my eye. Let's get the community involved. That empowers me and heals me. And I'm telling you, there are 7,500 people on this group who want to help, and they don't know how. And I'm speaking for all of them. Thank you so much, and I hope that you will follow up with me on some of these issues. Thank you. We need help, and I need help, and I can't get help for myself.
Thank you, Alana, for sharing your story and for your suggestions.
Thank you, Alana.
Thank you, Dan.
Thank you.
Megan, do we have another?
Yes, next we have Jamie.
Good morning, Jamie. This is City Council Lodge, Michael Flaherty. Welcome to the council hearing for public safety hearing. You have the floor. If you could just introduce your name and any affiliation you have for the record.
Thank you. I'm Jamie McLaughlin, and I am a former Boston resident. I'm actually still a Cambridge resident, and I speak to you today from Las Vegas, Nevada. I'm a human trafficking survivor, and I wasn't just trafficked by Jeffrey Epstein, but I identify as an Epstein survivor. Jeffrey Epstein lived across the street from Bill Cosby in New York City. Bill Cosby had a house in Western Mass. Ghislaine Maxwell was arrested in New Hampshire, but before she was arrested in New Hampshire, she was in Massachusetts. So I've heard a lot about having Jeffrey Epstein's client list released to the public, but what I'm more concerned with is his recruiters are still in Boston and they're still trafficking human beings. So we have these designer rape drugs, which is something that all of them use to control their trafficking, the people that they were trafficking. If, say, somebody is roofied in a bar, they're taken to an undisclosed location and then gang raped. And these human traffickers that are facilitating these gang rapes are making hundreds of thousands of dollars with each victim. And the victim will wake up and only have a vague recollection of what has happened to them. And there aren't, again, I piggyback on what this former panelist just spoke about, not having a set format for rape and testing for chemicals in hospitals. One time I went to Mount Auburn Hospital in 2019. The nurse took my pulse, said that I was dead, and offered to take me to the morgue and laughed at me. I was sent to Bill, even though I had Mass Health, and I don't even think they did a tox screen. When Jeffrey Epstein was being indicted, and the FBI was doing a lot of the investigations, they cleaned house. They murdered a lot of people. And in Boston for a long time, all you really had to do was leave a syringe at the scene. And then there was no autopsy, there's no toxicology report, there's no rape kit, the woman's just dead, the student's just dead, and there's no investigation. So for one thing, when we find the bodies of overdose victims, we should treat them with more care. We should do more autopsies. We should do more rape kits. We have an opportunity in Boston to lead a national example by refining the rape kit process, because you have the medical facilities, by doing those tox screens, by establishing an actual panel and a method of performing them that isn't invasive, that women feel safe, students feel safe going to the hospital, and they're not laughed at and not asked if I wanted, they were going to take me to the morgue. Another thing is to understand people hunt and rape in packs, and identifying the packs and breaking them up. We have a really poor history in Boston with Rose, who was the head of the policemen's union, and he was a pedophile for years, and he wasn't the only pedophile involved in that situation. So I think that there's also a consciousness that needs to be raised, and a set of morals that it isn't okay to rape children or to rape anybody. It wasn't that people didn't think Bill Cosby was guilty. It was that he got caught. And that was the biggest thing, that he got caught. So another thing that's happening on the border is that they have spyware, Pegasus. But that was 2 years ago. They have updated spyware. So human traffickers are able to hack your phone, your bank account, and your body. They hack your body. A lot of times they hunt. They hunt on college campuses. They hunt in high schools. They hunt in bars. They hunt all over. A lot of times the victims are chosen beforehand. They're stalked, they're gang stalked, and the use of technology is a huge tool for human traffickers. And another thing is that I believe that the fusion centers in New England are compromised. And the Boston City Council needs to establish a better relationship with the FBI, because the FBI just operates on their own terms. And so many of these human trafficking issues are multi-jurisdictional. So it's not just a Boston problem, but it is a huge Boston problem in the Cradle of Liberty. So thank you so much for allowing me to speak today.
Thank you very much, Jamie, and thanks for joining us from all the way out in the West Coast in Las Vegas. Megan, anyone else wishing to offer public testimony?
Yes, next we have Katie.
Good afternoon, Katie. This is City Councilor Elijah Mike Flaherty, Chair of Public Safety and Criminal Justice. Thank you for joining us. If you could just please state your name and any affiliation for the record, and you have the floor to address the panel.
Sure. My name is Katie Morrissey. I'm a 35-year-old resident of Boston. I've been living here for 10 years. My testimony has to do with my own case of basically being drugged this year. And I also have a roommate who was also drugged this year as well. We're both in our mid-30s. For her case, it happened at the Grand one night, and we weren't even aware of it until the next day. She ended up getting thrown out for being overly intoxicated. And then she informed me the next day that she had no memory or recollection of the night and hadn't been drinking that much. My own personal experience actually is a little bit more, I don't want to say concerning because any case is concerning, but my personal case, I was actually working that night at, I'm an event planner, and I have other jobs too. So I've actually, done a lot of work in the nightlife industry, but I was actually assisting with my company, like corporate company, my day jobs, CEO retirement party at the Fairmont Hotel. And so I was working that night, and I had maybe a glass of wine beforehand, and then my coworkers decided to go to the bar at the hotel, which was, I think, the Oval Room. And I had a situation where I even knew the gentleman who I think drugged my drink. And I had an incident where I literally had a glass of champagne before walking to my car to go home at like probably 11 p.m. at night. And I don't remember the walk back to my car. I woke up in my car with my stuff everywhere. I remember looking at my GPS and wandering around Boston for about an hour and having no recollection of that time. And it was very scary to come out of that and trying to have the experience of figuring out what to do. And I found that it was, for me personally, very difficult to know how I should go about this situation. And I didn't know, like, it took me a lot of time to figure out, the proper process. I probably didn't go to the hospital soon enough to get drug tested. It was something that actually, when I went to the police to report the incident, I was kind of reprimanded for doing. And it was, so the way in which the interactions that I had when I first reported it was kind of like, instead of like feeling supported, I felt like I was being, basically reprimanded for not immediately going to the hospital and not getting drug tested right away. And because I didn't do that, and I didn't really know where there was information on like what to do if you have been drugged, I waited too long. I didn't go to the hospital, and it was out of the system. And then when I spoke to the police, and the officer that initially helped my case was very helpful, but it only kind of went so far because I found out that the hotel had only had cameras on the entrances and exits of the hotel room, and the gentleman that I was talking to had told me that he had a hotel room in the building, so it's very unlikely that he left. And I knew exactly where I was positioned in the bar, but given the fact that I had all this information and knew who he looked like, there was no way to narrow down who the person was. And it's one of these situations where it might be a good idea to encourage, especially with bars or even nightclubs, to have cameras where drinks are being served. And that way, so when police are investigating matters, they can actually review footage. You know, I know that there was also a process in which there was a time period for footage to be reviewed without it, you know, possibly even being deleted. I think a lot of it has to do with like how much information we need to get to victims so that they know the proper steps to do in case they do get drugged. And there is like a lot, like that I was saying earlier, about shame, about, you know, people worrying like, hey, I think I got drugged, and whether or not they're going to get judged for it, or you know, if there's going to be any judgment behind them doing it, or if their story is going to be believed, or if they're oftentimes, you know, the question is, how many drinks did you have that night? And I think that there's a lot of need for dialogue on how to go around talking to people and victims, because the experience is traumatizing to go through. But also just general information on what to do when it happens, and just more education around like who to talk to, what steps you need to do in a timely manner, because it is a very much time-based situation, both in trying to like catch somebody, get footage, get tested, and, you know, having to go through this and also have a day job. It's like, it's very difficult to kind of like balance it. And it's like, you know, as a victim, it's like you really want the person who drugged you to be found, but knowing that, you know, like I didn't feel like I had a lot of resources for education on what to do. I didn't feel like, you know, I didn't realize the timeliness, and I think it would just be generally a good idea to just educate the public more on the process of what to do. I think it would be really good to encourage, like I said, venues to have cameras around bars, whether it's like actual bars, like, you know, hotel bars, or like venues, considering that a lot of the drugging, in my opinion, takes place usually around bars. And I know that, like, for the most part, like I said, a lot of places do have cameras outside the venues at entrances, but it would be one way in which it's a simple thing. And I know that, you know, it's probably a costly thing to install, but a lot of these places are making plenty of money that they can install some camera equipment that could possibly help with investigations and helping find people like that are doing it by reviewing footage, you know. And for me personally, it's just one of the two things that I found like after my incidents was those two things that I really wish were like different, because I think if I was more informed of what to do like sooner, and if the education was out there, I could have helped with the investigation going faster. Instead, it just ended up dead in the water, because just like, you know, I had no evidence of being drugged and we couldn't find the person. And so it just kind of, you know, and it's just this unfortunate incident that now lives in my history. But it would be nice if that we could have that sort of encouragement of like, hey, cameras, you know, educating the public on what to do. It's great to like offer like drink koozies and stuff, but, you know, there's a lot that can be done like for after the fact and into the investigation. I think preventative is great, but it also has to be considered what to do, because it's still going to happen even if you try to prevent it. And so having that education afterwards would really, I think, help some people and possibly even help the process of like finding out who these people are, like who are these perpetrators. So that's all I have to say about that. But thank you so much for allowing me to speak.
Katie, thank you for your courage. Obviously, you did nothing wrong, and hopefully your testimony will inspire others to share their stories, but two, also to help us make the necessary sort of changes to combat and to deal with this in an appropriate manner. Councilor Coletta, if you have anything else to add to Katie's comments, you have the floor.
Yeah, no, thank you so much, Katie, just for being here and for your bravery, and for everybody who gave public testimony. It's not it's not easy to relive these memories, let alone come to a public hearing and put it out there. But the fact that you are here is incredible. And like Councilor Flaherty said, will help other people come forward. So just thank you for being here and providing your perspective.
You're welcome.
Thank you, Katie. Next, Councilor Coletta. Megan, any other individuals wishing to offer public testimony?
Yes, we have one more, Raya.
Rhea, this is City Council Lodge. Michael Flaherty. Good afternoon and welcome to the City Council's Committee on Public Safety. If you just please state your name and affiliation, if any, for the record, and you have the floor to address the panels.
Thank you. My name is Rhea Becker. I live in Jamaica Plain. I've worked for many decades on violence against women, but I'm here as a very concerned citizen. So here's my theory about the whole thing. This epidemic will not be solved by awareness or curbing overindulging or special cups or security cameras. Bar buddies are nice, but only after the fact. So on the Facebook page that the earlier woman referenced for Booze in Boston, where some of the victims have been documenting their experiences, the victims say over and over again, they watched the bartender when they ordered a drink, they watched the bartender pour the drink, and they watched the bartender put that drink in front of them and never see anything suspicious. My theory is the bottles are being spiked ahead of time so that no one sees anyone doing anything to their drinks. There's really no other explanation I can think of. It's not a stranger walking over or anything else. So please don't think that these cups and these security cameras are going to do anything. Thank you.
Thanks, Rhea, for your public testimony.
Sure.
Megan, any other individuals wishing to offer public testimony?
Nope, that was it.
Very good. And I know that we may have some time sensitivities, particularly with respect to the chief and chairwoman of the licensing and then I know Councilor Louisiana wanted to talk to folks in and around the public health stuff, particularly leader health. So if Councilor Coletta has any specific or remaining questions for the chief or the chairwoman, in the interest of just the time sensitivities, as the chair, I'd like to release Chief Udaho and Chairwoman Joyce so they can get back to what they do best.
Thank you, Chair. I don't have any further questions for the Chairwoman and the Chief. I just want to say thank you again for being here. And I know we all are committed to this work and leaning in to let us know how we can be helpful. And we hope to be involved in future conversations, including the task force. Thank you.
Very good. So thank you. That will obviously excuse Chief and Chairwoman. Thank you for being here, both of you. And Councilor Coletta and Councilor Louisiana, I know that she wanted to maybe talk a little bit about leader health. So if anyone wants to dive into those issues, feel free.
Go ahead, Councilor Louisiana.
Thank you, and thank you for being here, Ilana. I know that we're scheduled to speak, so I'm looking forward to our one-on-one conversation, but I guess my question for you is, how have you been able to best sort of integrate or support the work that municipalities are already doing around issues of being responsive to the needs of survivors and just generally, like, what do you think we as a city in Boston can be doing better in this space? And I guess, I mean, the same question goes to you as well, Dave. Like, I know that BARC, as I said earlier, used to provide these trainings to bartenders. So what is it that we can be doing better, and what resources can we put towards being better partners with community and with all of you?
Thank you so much for the opportunity, Councilor, and I'm really looking forward to meeting with you. I want to thank especially the members of the public that just testified, sharing your truly tragic stories with us that unfortunately we're all, I think, familiar with. What I will say is that one thing that LEDA is very eager to do is partner with municipalities like Boston to potentially make access to care and reporting more frictionless, remove barriers to reporting. So for example, if somebody is too scared or there are other reasons that they can't or won't go to a hospital, or to law enforcement. We want to create different options for them or additive options for them to sort of memorialize what they believe to be their, a crime that has been committed against them, whether it is the drink spiking itself and they want to do a toxicology screening in a timely fashion so that there isn't this issue of degrading of evidence that occurs when too much time has elapsed, or the timely collection of forensic evidence in the instance of a sexual assault, which is one of the services that we provide. And I think that speaking to this sort of education and training issue, that the installation of not just signage, but products and goods that make it easier for somebody to collect their own evidence and show that this may have happened to them, either the toxicology screening or sexual assault itself, gives folks an additive option for capturing that information before it has disappeared, degraded, before it is too late to accurately capture that information. And also the physical presence of, for example, our boxes that we use for distribution of our EEKs and potentially for toxicology screening, serve as a talking point, right? If you install a box in the bathroom of an establishment or on a campus, that is a statement about how that institution feels and where they stand on these issues regarding drink spiking, regarding sexual violence. And the sad reality is that 70% of sexual violence survivors never, ever connect with any kind of medical care or law enforcement. So there's already some chilling effect that happens, and we know that, right? It's probably the most underreported crime, maybe human trafficking is slightly more. So we really view this as an opportunity for jurisdictions to take a very, very strong stance on opposition to this type of crime, so folks know that they can't act with impunity.
Thank you so much, Ilana. And Dave, I don't know if there's anything you wanted to add.
Yeah, recognizing time, I'll try to be brief. I think sort of like we discussed before, and I think we've heard over the course of the hearing today, coordination and collaboration can be a really strong tool to help prevent or ensure that survivors have access to the supportive services they need. That can look a lot of different ways. BARC does facilitate the sexual assault response team in Cambridge, which might be a model for something similar here, where once a month, the BARC and a variety of other institutions, including Cambridge Police, I know BPD has come to some of those meetings as well. Some of the local area schools in Cambridge, as well as some of our hospitals, can get together and talk about some of the issues that they're seeing. And if one of the things that we're hearing is folks who've experienced this didn't feel like they had awareness of or access to the information about the resources that could have helped them heal or follow up with law enforcement in a timely way, sometimes things like a SART can help make those things a little bit more functional. There are also opportunities for, again, sort of cross-promotional posters or public service announcements, whether that's things like posters, advertisements in the T, making sure things like the BARC phone number is available, but also other numbers are available. If the chief is in a position where some form of city-based resource is available that folks can call and get sort of a one-stop set of referrals, that's one way to help connect folks to resources quickly and in one place. The prevention side of things is deeply close to BARC's heart. That's harder just because there's a lot of components that go into it. Again, the training that BARC used to do, and it sounds like some of our establishments are pursuing in their own direction. They are promising. They've had some strong impacts, but making sure that they are as effective as they could be long-term requires consistency and probably a pretty good amount of resources and some city muscle behind them. So those things can be pretty valuable in helping prevent this kind of situation before it happens, but they need to be sort of long-term solutions. And I know that BARC would be really excited to engage in those conversations with the city and other agencies about how we could make that happen long-term.
Thank you, Dave. I really like that. I really like a lot of what you said, especially around the idea of the model that you've had with Cambridge. So I want to thank you, Dave and Ilana, for being here. I also want to thank those who came and gave public testimony on issues that were very personal, that really helped educate us on the best way forward. So just my heart goes out to all of you for the ways in which we and our systems have failed you, and we're trying to get it right. So thank you, and thank you to everyone else for being here.
Thank you so much.
Thank you, Jessica. So there's obviously no, Megan, there's no one else additional looking for public testimony. So as we start to wind down, obviously give Councilor Coletta, we just heard from Councilor Lujan, to give Councilor Coletta sort of the final word. Thank all of the panelists for your engagement and your involvement in helping and trying to solve this problem. We know that young women, or young women probably in particular, simply out to enjoy the city should be able to do that safely and not be preyed upon. So, and no matter what neighborhood, no matter where you are in the city, that should be the case. So this is an extremely important issue. Obviously the difficulty is contaminated drinks are all too often underreported. So it's also hard to detect, and it's hard to prosecute. So, just collaborating and, coming up with innovative ways to increase safety and to better support victims. Clearly that's what with this hearing and the committee is committed to do, working with the lead sponsors, both the Councilor Coletta and Councilor Lujan. So with that, Councilor Coletta, final words for folks that are here, thanking everyone for their time, for their attention, for their dedication and experience, obviously, and skill set to help lend a hand here. Yep. So for all of you, appreciated it on behalf of the committee, your willingness to participate and work with Councilor Coletta, Councilor Lujan to bring this forward. So with that, Councilor Coletta, you can have final words, and everyone can go about there right afternoon.
Thank you, Chair. And I just want to echo the thanks to everybody just all around for being here and giving 3.5 hours or 2.5 hours of your time. I know everyone's busy, but this is obviously a really important issue. And it's just a staggering statistic, as 70% of survivors don't come forward. And like Ilana mentioned, it's an opportunity for the city to take a stance by providing resources and support services to those who need it most. And we've got a lot of work to do, but just know that we collectively, to those listening, we'll get to work to best serve and protect our residents. And Chair, I have been taking diligent notes, so please indulge me as I make sure I get everything, and I'll follow up on the record. But just in terms of following up with BPD, there was a proposal from my colleague Kenzie Bach to create a form online to report an incident, to make it easier to report. Councilor Lujan suggested creating a hotline within BPD for folks to call. There are certainly, what I identified, there are certainly some opportunities as it relates to tracking these incidents within the Mark 43 system. It sounds like there's not even an option to collate this information during intake, so that's certainly an issue, and I would love to follow up, as the Lieutenant Detective said, with Commissioner Cox to figure out what we can do to change that. Better training for police officers to better identify signs and symptoms, better training for our venues, either through city standardized processes, through the city, and then creating standardized processes and protocols through the licensing board, where folks and venues aren't afraid for liability. And of course, breaking down barriers to reporting, access to toxicology testing and sexual assault kits directly to hospitals, venues, and colleges. I definitely think if there are any follow-up conversations, and as a suggestion to Chief Adwowo, and I'll follow up with him, but bringing in the Boston Public Health Commission and our hospital partners to talk about standardizing their process and making it easier for victims to come forward. Of course, just continuing the collaboration with colleges and through the Office of Economic Opportunity. Again, I'm pleased to hear that they will be providing financial resources for some of the smaller preventative measures for venues, like condom cups, scrunchy cup covers, and a commitment to exploring financial assistance for cameras and outreach materials. But we all know that it's a multi-layered strategy, and so it's going to take all hands on deck. But I look forward to continuing the conversation, and again, just want to express my gratitude to everyone who's here. It's clear that we'll keep this conversation going and push for follow-up. Thank you, Chair.
Okay. Thank you very much to both Councilor Coletta and Councilor Lujan for being the lead sponsors, for all of my colleagues from attending, for all of our panelists for spending this last 2.5 hours with us, and we'll continue to work together on it. If there's any follow-up, clearly, Councilor Coletta, on behalf of the council, as well as the committee chair, we can get that information disseminated. But let's just keep working together, and hopefully we can. The number of 0 would be perfect, an ideal situation, but nonetheless, we clearly must be able to do a better job. 73 reported incidents are clearly too many, and by working together, hopefully we can eliminate this predatory behavior in our city. So with that, the Committee on Public Safety and Criminal Justice hearing on docket 11-404-1104, order to address contaminated beverages in bars and clubs, sponsored by Councilor Coletta and Councilor Louisiana, is adjourned. Thank you, everyone, and have a great weekend.
Thank you, sir.
Thank you.
Thank you.
Everyone.
Thanks, everyone.